Good afternoon. My name is Violet McLeod, and I will be your moderator for today's press conference. Before we begin, I would like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Premier, go ahead.
Thank you, Violet, and good afternoon, everyone. Today, we are reporting 149 cases today, with most in the Central Zone. Some of these cases are still from the backlog. We want to get that number down, but it's going to still take some time. And this third wave surge is proving to be aggressive because of the variants. We currently have 75 people in the hospital and 15 in ICU. Our health system is under immense pressure, but I want to assure all Nova Scotians that we continue to have access to critical care where and when you need it. We have enough beds across the province. The variants are still on the move in our province, and that's why we have to continue to follow the restrictions. And I want to thank all Nova Scotians for continuing to follow those restrictions. A special shout out to our Muslim Nova Scotians that are celebrating Ramadan, obviously different this year, and having to adapt to virtual and connecting other ways. And Eid Mubarak to all those that have celebrated Ramadan. As we limit our movement, we need to continue to stop the spread. And that means if you have symptoms, you need to stay home and get tested and isolate until you have your results. But we know it's not easy for everyone, and many people do not have access to sick benefits, even if it's just needing to stay home for a couple of days if you have symptoms or if you're waiting for results. And that can cause a financial burden. And we know there's a Canadian federal sick benefit that I've referenced in the past, and you're eligible for that, but there are some gaps that we hope to fill today with a new program that will help keep you and your loved ones safe. So today we're announcing a new paid sick leave program. It allows for workers to qualify for up to 4 paid sick days, and this is to complement that federal program. We want employees to stay home if they're feeling unwell and follow public health protocols to help reduce the spread of COVID-19. People who cannot work remotely and miss less than 50% of their scheduled work in 1 week period due to COVID will be eligible. This includes Nova Scotians that are waiting for their PCR test results, if they're getting tested, self-isolating while waiting, or getting their vaccine. The new program covers employee wages, including those of self-employed people, and that's up to a maximum of $20 an hour or $160 per day. The maximum payment is over a 12-week period is $640. The employer can now continue to pay their employees and then will be reimbursed under this program. If the individual does test positive for COVID and they have to self-isolate for 14 days, there are other programs that they're eligible for, both provincially and federally. On the vaccine front, this program, our restrictions and, of course, getting everyone vaccinated are part of a suite of measures that will help stop the spread and protect us from the virus. Our rollout is underway, and I want to thank everyone for getting their shot and to those that are working to get shots out to all Nova Scotians. There continues to be some concern around AstraZeneca. A number of provinces have already chosen to take a pause on this vaccine. It's difficult for me to think of saying no to any vaccine, but my goal as your Premier is to get everyone immunized as quickly as possible. Nova Scotians are deciding on their own to choose the mRNA vaccine before AstraZeneca now, since we've dropped the age cohort down to 40 and up. More and more Nova Scotians are canceling their AstraZeneca appointment and choosing the mRNA vaccine. Over 1,000 appointments have been canceled, and our health providers are telling us that most people are choosing the mRNA. There is a global study underway to determine if an individual who took their first dose of AstraZeneca can mix their second dose with either Pfizer or Moderna. That is an important piece of science that we're awaiting. And until that study is complete, we are putting a pause on the AstraZeneca vaccine. This will not take us off course, to be clear. Our vaccine program continues to roll out on schedule. And it's my hope that we'll continue down this path to get everyone a shot of vaccine in the month of June. But Dr. Strang and I do want to accept a vaccine that has no potential of being wasted, and that's why we're pausing that today until further notice. I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. The decision to pause the use of AstraZeneca is based on caution, science, and the availability of alternative mRNA vaccines from Pfizer and Moderna. With a national and global concern around the serious side effect VIT, it is the best solution to move people who were to get AstraZeneca to receive mRNA vaccine instead, because their age eligibility completely overlaps. As we move these bookings to Pfizer and Moderna as soon as possible, I ask for patience for those who will have their appointments canceled and then rebooked. You will get vaccinated soon. The support for sick time announced today is also good news. People who are sick need to get tested and isolated, and now that will be easier for many. Workplaces have become major contributors to COVID-19 transmission, and we all need to work together to stay safe. Employers, if at all possible, please have your employees work from home. If they can't, ensure public health protocols are followed, including daily symptom screening, strengthening mask requirements, and minimizing numbers in break and lunch rooms. If your employees are sick, they simply cannot be in the workplace. And employees, we ask that you take every possible precaution while at work. Where possible, avoid activities or areas where people are not wearing masks. And absolutely do not go to work if you are a close contact of a positive case or if you have symptoms, even mild. Many of our workplace clusters are beginning when people being at work for multiple days while they have COVID-type symptoms. We are starting to see early signs of our case numbers that are trending in the right direction. The restrictions are beginning to make a difference. The number of new cases is trending down, and compared to a few weeks ago, there are much fewer close contacts connected to each case. The backlog of positive cases was cleared yesterday. Today's number includes the last of those cases in the backlog. Public Health will again start case investigations within hours of receiving a lab confirmation. And I want to give my sincere thanks to both the lab and public health teams who have been working day and night over the last week or more to clear both backlogs and to keep Nova Scotians safe. Unfortunately, many Nova Scotians are very sick, and the number of hospitalizations is higher than we like. We have had to transfer some patients in the ICU in Halifax to ICUs in other zones. All aspects of our healthcare system are now being impacted by this outbreak. So we are not out of the woods yet, and this could get worse in the days ahead. There is always a lag between cases and severe illness, and hospitalizations may still increase even while new cases are declining. There is still a lot of virus activity around Nova Scotia, and we all need to stay vigilant and follow restrictions. People's lives depend upon it, and our healthcare system depends upon it. Testing remains one of the most important things we can do to keep a handle on this outbreak. We need to find every positive case to stop the spread. So please get tested and do it regularly. If you're sick or a known close contact of a case, isolate and book a test at a primary assessment center. Public Health issues notices for sites where people may have been exposed, and we have just restarted notifying people about low-risk sites. And a long list was released last night with many retail and grocery stores included. And they emphasize these are low-risk sites, but anyone present at one of these sites is asked to get tested, but you do not have to isolate while you're waiting for your test result. The message is, especially in the Halifax area, if you are out and about in the community at all, assume you may have been exposed to the virus and get a test. You can get a rapid test at one of the pop-up sites or book one at the primary assessment center. We are ready to process as many tests as we can get. Getting tested regularly is one of the easiest and most important ways to protect yourself and your community. And I do want to provide some clarity on the isolation requirements around testing and advice for you and your household. There's been some confusion in this area in the last few days. So first, if you are asymptomatic and getting a test as part of your routine, you do not need to isolate while waiting for your test result. However, if you become unwell and have any symptoms of COVID-19, you have to assume that you have the virus and book a test. And you and anyone who lives in the same household as you must isolate until you get a negative test. And if you're a close contact of a positive case, you must isolate for 14 days no matter what and do repeated testing. And anyone living with you must also isolate until you get a negative result. If you become positive, public health will advise the rest of the household what to do. And I also want to provide some clarification on some ongoing confusion around travel, both within and into the province. On Monday, we announced a compassionate exception process for those moving to Nova Scotia. We certainly did not intend for the border closure to result in anyone not having a place to live. And as the Premier has said, we want you to come here, but just not right now. However, we know that some people may need to be here right now. So we will consider exceptions for people in the following circumstances. So if they have a purchase or sale agreement for a property that was purchased in 2021 and showing that the offer has been accepted on or before April 21st and that there was a closing date on or before May 20th. If you have a minimum one-year lease signed on or before April 21st, and that begins on or before May 20th, or you have a letter of acceptance for new employment in Nova Scotia and the work cannot be done virtually or your start date cannot be deferred, and the letter must be dated on or before May the 7th. So if your situation fits one of these three criteria, please visit our website where you can apply for an exception. Please do not apply if you plan to move here after May the 20th. Right now, we're only considering exceptions for those who need to travel before then. The majority of Nova Scotians want to do the right thing. That's why we're getting hundreds of questions about travel within the province. People do not want to break the rules. Please consider whether your trip has to happen now or if it can wait. If it can't, we ask you to use your judgment and common sense. There is a directive in place that legally restricts travel because we know some people won't otherwise follow the rules. The directive defines your community as your municipality, and necessary travel reasons such are school, work that cannot be done at home, health care, including trips for immunization or a COVID test, child care and other caregiving, child custody, attending a funeral or end-of-life visit, complying with a court order, and providing or securing essential products or services. But we know that some of you have other good reasons for travel within the province. What is necessary for some may not be for others. For example, you may need to move to another community or help someone move, pick up an item you paid for, get a vehicle that's repaired, especially under warranty at a specific service center, or give someone a drive. It's fine to do these things as long as you are extremely careful. Don't make any other stops. Do things in a contactless way. Use drive-thrus and wear masks if you're in close contact with anybody else. However, you do not need to go to another community to golf, to fish, to camp, buy a particular product, or get in a better appointment time at an Access Nova Scotia center. Stay in your community if the essential products and services you need are available there. So again, we ask people to do as much as possible, stay close to home. We know that some travel is necessary. Use your common sense and then make careful, safe choices if you do need to travel more broadly. And in closing, be encouraged by the news where we're at, but also remain cautious and careful. Stay strong for May. Get vaccinated. And to all the Muslim Nova Scotians celebrating the end of Ramadan, happy Eid al-Fitr.
We will now take one question and one follow-up from media in the amount of time we have for today. We'll begin with CBC Mike Gorman. Mike, do you have a question?
Thank you. Premier, people have been calling for paid sick time in this province for more than a year, and I don't see a whole lot in the last year that's changed in terms of the circumstances for people requiring it. So what about now has caused the government to shift its position on that? And I wonder if you could also talk about those gaps that you mentioned as it relates to the federal sick leave program.
Certainly. So this has been a topic of federal discussion, and they've extended their Canada Sick Benefit program. You're eligible for their program if you miss at least 50% of your work week. So there's a gap of if someone is symptomatic and they think they may miss just 2 or 3 days. I think that some of them may take a risk and go to work for financial reasons. So we want to eliminate that as a possibility to prevent any spread in some of these workplaces. So we have been looking at this for months now, as other provinces have. I think you've seen other provinces come out with similar programs. This is one is based on a scan of other programs to ensure that there is that opportunity for those that are missing 4 sick days, that they have that eligibility, and it's paid by the government, not the businesses.
Mike, go ahead with your follow-up.
Thank you. Dr. Strang, with respect to the pause on AstraZeneca, notwithstanding the information that you've already provided, people who have had AstraZeneca in the past have heard you and other health officials say that the best vaccine is the one that's available to them now. And so what would you say to folks who have recently had AstraZeneca, or perhaps not even recently, and are perhaps concerned when they see that the province is now hitting pause on taking any more and, in fact, canceling appointments for people who already have those?
So first of all, maybe other public health officials have said that. I've never held that position. We've always in Nova Scotia taken that people may have a choice on vaccine products, but we've made sure that they have an informed consent about the various risks and benefits of the different vaccine products. And we've been very clear that AstraZeneca has some unique risks to it, and made sure Nova Scotians were given that information, allowed to make a choice. What we're at now at a position now, we're saying that because we now have mRNA vaccine into the 40-plus age groups, it doesn't make sense to continue to offer the AstraZeneca vaccine because the mRNA vaccines don't have the same safety signal. We're going to continue to make sure that we vaccinate Nova Scotians as quickly as possible, but we have sufficient supply of the mRNA vaccines, and we're now in the age group where we can use that preferentially, which aligns with the consistent recommendation that has always been there from NACI.
Next, we go to CTV, Natasha Pace. Natasha, go ahead.
Thank you. I just wanted to be clear, Dr. Strang, have there been any cases of blood clots being linked to the AstraZeneca vaccine in Nova Scotia to date?
There have not, no.
Natasha, go ahead with your follow-up.
Thank you. I wanted to ask you about the outbreak of COVID at the 811 call center in Dartmouth. We're hearing there are 11 cases involving employees having COVID at the center, and in addition, some of their family members of employees have tested positive. Can you talk a bit about that specific scenario? The union has now placed a complaint with the Department of Labor to investigate whether or not proper protocols are in place there.
So I'm not involved in specifics of any one outbreak. That is the role of the regional medical officers and the local public health team. I'm aware of that situation. Like any workplace, when we have a case or cases, public health works with the workplace to identify who's been in close contact, who needs to be isolated because of close contact, and provides recommendations to the rest of the workplace and the rest of the employees in that workplace about appropriate public health actions. About sometimes we uncover that it's not uncommon that actually the source of the spread within the workplace is poor adherence to COVID protocols. Often protocols are in place, but they're not being followed carefully. So that is that we bring that to the attention of both the employer and the employees, and we continue to work with our colleagues in occupational health and safety, labor and advanced education, around making sure that all workplaces have appropriate information so they can develop and adhere to COVID protocols. At the end of the day, we have to rely on the relationship between employers and employees to make sure that they're working together to make sure that the protocols are followed.
Next, we go to Global News. Alicia Drowse. Alicia, go ahead.
Thank you. Dr. Strang, on Monday, I believe you had said that our AstraZeneca supply was more or less used up. So I'm just wondering if you can clarify how many doses of AstraZeneca do we actually have left at this point, and what happens with those extra doses? Will they be potentially used for second doses?
So there's my understanding this morning is about 2,500 doses of AstraZeneca left of our total of 60,000 that we had. Though they're in pharmacies and doctors' offices, we'll keep them in the fridges there, but they have an expiry date at the end of June. We're waiting to get some direction, probably in early June, from NACI around whether we what is the appropriate approach to take for which vaccine product for people whose first vaccination was given with AstraZeneca, and so we're waiting for that information, and we can hold the vaccine we have in the fridges, and while we get that direction, then make some decisions around second dose.
Alicia, do you have a follow-up?
Yeah, so can you clarify what happens if we don't get more clarification on the what happens for those who have already had their first dose by, before the end of June when these doses potentially expire? I know a lot of people who have already gotten AstraZeneca are now nervous if their first dose is even valid, or like if they can mix them, or if they'll have to get fully vaccinated with 2 doses of another vaccine.
So no, that's exactly what we're waiting for, the assessment of the science. There's studies underway, especially in the UK, to help inform this. We expect that we're going to get that information. NACI's going to review it and make some recommendations. We anticipate that's going to be early in June. And then from there, we'll make decisions around what are the appropriate vaccine products. Certainly we know that people who had their first dose with Pfizer or Moderna, their second dose will be an mRNA product. It's more the question, people whose first dose is AstraZeneca, what is the appropriate product to offer them for second dose? But we'll get information on this before we're at the time frame where we need to be giving people a second dose of vaccine, which is starting in early July. So we'll get the information and make decisions before we need to start putting needles in people's arms for the second dose.
Next, we'll go to the Canadian Press. Danielle Edwards. Danielle, go ahead.
Hi, this question is for Premier Rankin, but there was a letter sent out by the CCLA with concerns regarding the new restrictions that bar people who may have purchased property or have a lease agreement that falls after May 20th. It seems as though the rules are such that they won't be able to enter the province, and the CCLA has suggested that these new measures are unconstitutional. So do you have a comment on that in regards to the new rules, Premier Rankin?
So as was outlined in Dr. Strang's remarks, there is a compassionate exemption clause for those that have been involved in purchase of a home before April 21st. If they had a purchase and sale agreement, an employee offer for work, those types of things. There are exceptions to that rule, but we're very confident when we put in restrictions after going through our own legal advice where we're going with that. Public health, we're in a state of emergency, and we're confident with the restrictions that we have in place in the province and at our border.
Danielle, do you have a follow-up?
Yes. I'd also like to ask Premier Rankin if you have any plans or any idea as to when these measures, specifically with the border closure, will be lifted.
So we've said public health has said the month of May is a critical time frame for us. Right now we're 2 weeks into the shutdown. We still have high cases, and we'll continue to look at where we're going from beyond that period of time. But there's not even any discussion of relaxing anything in the near future right now.
Next, we'll go to the Chronicle Herald. John McPhee. John, go ahead.
Thank you. Dr. Strang, the people who have AstraZeneca bookings now, will they be prioritized for an appointment for the other vaccines since their bookings will be canceled?
Yeah, the vaccine program team is working with our online booking Can Immunize to make them to get them appointments as soon as we can.
John, go ahead with your follow-up.
Thanks. This is again for Dr. Strang. I'm just wondering why we are listing the lower risk exposure sites again. Are you finding community spread more widespread, or has somebody been identified as getting it from just going to a store, for example? What's the rationale there?
No, that's simply when we're at our peak, and partly because of we still need people out. They're likely exposed if they're out and about. Some of that was simply the volume and how we manage things within public health. As we've caught up with the surge of tests, at first the lab and now with public health, we're in a place again where we can, where it's useful to have those public notifications. And part of it is we want lots of people to be tested. We always have had, and we know that those notifications help drive people for testing.
Next, we have All Nova Scotia. Brian Flynn. Brian, go ahead.
Hi, Premier. You were asked Thursday about concerns that Margaret Miller raised with your Chief of Staff regarding the behavior of a staff member you promoted. You said in response to the question, I would suggest that if somebody has an allegation of a staff member to bring it forward to me or follow the process. Margaret Miller told me that she did, in fact, raise this concern with you months ago after you won the Liberal leadership. Is this correct? Did Margaret Miller bring these concerns to you or your staff at that time?
No, Margaret brought forward, she said that she did not want to continue to be in MLA. She looked forward to me calling an election. And I said I couldn't guarantee when that election call would be. Subsequently, she mentioned in April that she would like to resign in June for family reasons.
Brian, do you have a follow-up?
So just to be clear, Premier, you're saying that Margaret Miller, what she told me, is incorrect. She never raised her concerns with you or your Chief of Staff before May 4th about this staff member?
Well, I don't know what your conversations are. I can just tell you that I've spoken to Margaret a few times about her future, and she made it clear that she did not want to continue to serve for family reasons. I respect that. And I've had conversations with other colleagues to ensure that our workplace continues to be a safe environment, and I'm going to continue to have that conversation with all of my colleagues.
Next, we go to the Halifax Examiner, Tim Bousquet. Tim, go ahead.
Hi, good afternoon. Dr. Strang, I guess lots of people are wondering about the status of the daily updates. You told us last Friday that you thought the numbers would be down by midweek. You said that the same thing the Friday before that. It seems like the numbers are not coming down. They keep going up or fluctuating. Are we going to see decreased numbers tomorrow or next day?
So I can't give you a guarantee what we're going to see. Our numbers, if you look at where we were last week, it's not an individual number, it's the trend. And we certainly are in the last few days starting to see a trend downward. There are going to be fluctuations within that. We fully expect some of the other metrics we look at, such as I mentioned, the average number of contacts per case, which has come way down, which is really a direct indication of the impact of the public health restrictions and people being separated from each other much more. So we are starting to see the impact of the first 2 weeks of our provincial lockdown. We fully expect that we're going to see that downward trend continue. There will be some fluctuations, but I can't give you a 100% guarantee of exactly what the case number is going to be tomorrow.
Tim, do you have a follow-up?
I have a question specific to the urban shipyard. There's been a number of cases identified there. It's a tight work quarters. Why hasn't that workplace, which is primarily funded with public money anyway, why hasn't it been shut down? Why is it allowed to continue to operate?
So the Irving shipyard is actually multiple workplaces. It's really divided up, and we've had cases divided between the different areas. We're working very closely with Irving on that. There's one portion on one of the ships that is outside. It's already gone through the assembly hall, which has the greatest concern. We're still continuing to doing a lot of testing on all the people working on that ship. I have my public health team and myself have a meeting with Irving management tomorrow morning to discuss this. But at this point in time, there's been no indication that we need to shut down any or all of the shipyard. We might reach that conclusion tomorrow. But again, we actually look at that shipyard as multiple workplaces, and we deal with each of the different areas separately. So we may make conclusions about one part of the shipyard, which are different from our conclusions about other parts of the shipyard.
Next, we'll go to Radio Canada, Adrian Blanc. Adrian, go ahead.
Thank you. Dr. Strang, we've seen the number of lab tests that are completed every day fall dramatically. What is the impact on the number of cases per day?
So we absolutely want to make sure we're testing people where appropriate. Even though our testing numbers have come down, 7,000 or 8,000, you have to remember that prior to this surge, we were testing as low as 2,000 a day. So we're still testing large numbers of Nova Scotians, and those numbers are from the lab. They don't actually include the several thousand cases that we're doing through pop-ups. But we are still testing lots of people. We have additional lab capacity. We want to use that lab capacity. So that's why one of the reasons we're going back to the public notifications, even for low risk, because people tend to pay attention to those and they go out and get tested. And we continue to emphasize the need for Nova Scotians to build regular testing into their ongoing COVID protocols every time we're here at the briefing and through our social media. So we're working in many ways to make sure that we're testing as many people as possible through our different testing streams.
Adrian, do you have a follow-up?
Yes, you mentioned that some ICU patients were transported from Halifax to other hospitals. Could you be a bit more precise? How many patients and to what hospitals?
So you'd have to follow up with the Nova Scotia Health Authority for the more details on that. And of course, we always have to be careful about disclosing privacy. But they have more, and Nova Scotia Health Authority would have more of those details.
Next, we go to Globe and Mail, Marika Walsh. Marika, go ahead.
Good afternoon, Dr. Strang. I'm wondering if you can explain a bit more what happens now with the AstraZeneca. The federal government public health agency has now told the provinces how many doses of AstraZeneca they're getting in the weeks ahead through the COVAX shipment. In Ontario, it's more than 200,000. So will Nova Scotia be accepting the delivery of AstraZeneca from the federal government?
So we've actually had conversations with the National Operating Center just this afternoon, and they're very happy they will be holding on to Nova Scotia's allotment of this next shipment of AstraZeneca vaccine while we get the evolving evidence on the second dose approach and what may potentially be the need for AstraZeneca vaccine as we move into second doses. So we'll be making decisions around second dose, and the federal government is agreed to hold on to our shipment nationally while we make those decisions.
Marika, do you have a follow-up?
Yes, I do. Thank you. Can you, Dr. Strang, also explain to us just a bit more? Some provinces are only pausing the first dose administration for now. You seem to be saying that all dose administration is being stopped. Can you clarify if the window is open to ever return to administering AstraZeneca first doses, or are you only now looking to the second dose question for the limited number of people who received the AstraZeneca shot? And what is the rate of it that you are working off of?
So we're working on the national rate of VIT. We have had no VIT here in Nova Scotia. That's really, we have to look at things from a national perspective. As I've said several times today, we're pausing and not using AstraZeneca anymore for first dose. We're going to wait for the science to come and clarify what if any, is the use of AstraZeneca for second dose. We certainly know that people who got a first dose of mRNA vaccine, they need to get an mRNA vaccine for second dose. The question that we need science to answer is, if your first dose is AstraZeneca vaccine, what is the appropriate vaccine to use for your second dose? So we'll get that answer, and then if we need AstraZeneca vaccine, we will have it available through the national procurement process, and we'll move ahead as we move through the summer with our second dose program.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you, Violet. We talked earlier about the number of people in hospital with COVID-related complications. It's a worry, especially because our ICU numbers are also high. We have enough beds spread out across the province, including critical care beds. I understand it must be hard to have a loved one fighting this virus in the hospital, but I know every patient is getting the best care possible, and they are where they need to be. I want to thank all of our frontline healthcare workers who every day risk their lives to save ours. We talk a lot about current cases of COVID, but we don't talk a lot about the recovery. People are recovering. People are leaving the ICU and the hospital. I have no doubt that those of you that are working on the front lines are tired and fed up with COVID, especially in this third wave surge. But you're doing extraordinary work, and we are all so grateful. You go out to work every day to protect us and keep us safe. On behalf of all Nova Scotians, thank you. And the best way for us to show our gratitude is to continue to follow the public health protocols and restrictions so that we can continue to stop and slow the spread of this virus. Thank you.